This is Parca's clinical section 2.4, and it covers the circulatory systems, the systemic circulatory system, the pulmonary circulatory system, and the peripheral circulatory system. And then it goes on to arteries and veins. And then for the next part, the cranial, thoracic, abdominal, upper and lower vascular anatomy, don't freak out in those sections. Okay, that should be the title of this video, is Don't Freak Out. And you'll see why in a minute. Systemic circulation. The systemic circulation provides the functional blood supply to all body tissue. It carries oxygen and nutrients to the cells and picks up carbon dioxide and waste products. The systemic circulation carries oxygenated blood from the left ventricle through the arteries to the capillaries in the tissues of the body. That is systemic circulation. Then you have pulmonary circulation. Pulmonary circulation is a system of transportation that shunts deoxygenated blood from the heart to the lungs to be resaturated with oxygen before being dispersed into the systemic circulation. So that's just a circuit that runs between the heart and the lungs to take all that blood that's come back that doesn't have any oxygen over to the lungs to pick up oxygen and come back to the heart before being sent out to the rest of the body. Peripheral circulation is extremely important for transporting blood around the body, exchange of nutrients with tissues, and storing blood. The variety of tissues in the body and their need for blood and nutrients varies. Therefore, the peripheral circulation must match the flow of blood to the demand. Basically, what that means is, if you're running, your legs are going to need more oxygen, right? And so it's going to change the flow of blood so it sends less to your hands and more to your legs. The peripheral vascular system is part of the circulatory system that consists of veins and arteries, not in the chest or abdomen. So you need to know those three types of circulation: systemic, pulmonary, peripheral. A lot of questions come from those. A lot of questions about arteries and veins. Arteries carry blood away from the heart. Veins carry blood towards the heart. With the exception of pulmonary blood vessels, arteries carry oxygenated blood and veins carry deoxygenated blood. Arteries have thick walls of muscle tissue. Veins have thinner walls and use valves to keep your blood flowing. Lots of questions about the difference between arteries and veins. This is the part you need to not freak out about as we get into the anatomy of the arteries and veins. I know this is a very busy slide with a lot of things on it. Parca doesn't ask a lot of vascular anatomy questions, and when they do, they stick to the big veins, right? So they'll ask questions about the common carotid artery. They'll ask questions about the internal, external jugular vein, okay? So they will not be asking questions about all these. If you want to learn all the arteries and veins, they're on the slide. You can go wild with vascular anatomy, but just learn the big ones and you'll be able to get the questions on the test. So on this slide, you want to know the aortic arch, the descending aorta, the left coronary artery, the right coronary artery, the ascending aorta, if I didn't mention it already. Those are the big ones that commonly come up as test questions. And keep in mind, we're only talking about one or two test questions. And, there's 50 questions. You might get one about vascular anatomy, and you can miss 5 and still pass the test. So don't spend a lot of time learning all of these tiny arteries and veins. Just know the big ones, and you'll do good on the test. So everybody loves this one, the superior mesenteric artery. That one shows up more than any other vein or artery on here. The superior mesenteric artery and the vena cava show up in the abdominal aorta. Those are the ones you need to know off that slide. There's really none. Nobody has ever reported seeing any of these arteries or veins on the test, but they're there in case you want to know them. And the femoral artery shows up a couple of times on test questions. Other than that, that's pretty much it for arteries and veins. Like I said, don't freak out about learning every artery or vein. Just know the big ones and you'll be fine. Thank you for watching.